If you're considering a BBL, you might want to know how the scars look after surgery and what you can do to care for them as you heal. In this quick video, I will answer 4 of the most common questions when it comes to BBL scars, so you can rest easy. The first question you might be asking is whether I'm going to have scars at all from this surgery. Well, as the procedure involves liposuction and the injection of fat into the buttock, you should expect some minimal scars where incisions are made. In total, liposuction during BBL requires 2 to 5 small incisions. This depends on the number of areas targeted. The fat transfer portion of the BBL also involves small incisions on the upper or lower region of the buttock. Therefore, in total, there will be 4 to 8 incisions. As you can expect, the more areas of the body treated, the more incisions there are likely to be. The second question that patients want the answer to is what the BBL scars look like. The scars from liposuction and fat transfer look like small dots, usually around 5 mm long, which is usually big enough to accommodate the suction cannula. Scars should become thick and red in appearance, or sometimes purple and raised in the first 6 to 8 weeks, before it flattens and gradually fades over the 6 to 12 months. At the end, it tends to leave small mark like a spot. Some skin types can leave dark pigmentation around the scars or thick or lumpy scars called keloids. As surgeon, we will also take scarring into careful consideration when planning a BBL, and will try to make these incisions so that the resulting scars are in places where they blend with the natural curves and contour of the body, or where they can be easily covered with clothing. There is some important advice that you should follow to make the incisions heal properly and minimize the appearance of scarring as much as possible. First, make sure you're avoiding sun exposure as much as possible. This is generally good health advice anyway, but scar tissue is particularly sensitive to sun damage. In fact, too much sun exposure can cause scars to become permanently pigmented, preventing them from blending in with your skin. Try to keep your scars out of direct sunlight for the first 6 months after surgery. Wear clothing over your wounds and apply sunscreen regularly to prevent sun damage. Secondly, when the incisions have completely healed, applying pressure to the scars can help to improve their appearance. Try gently massaging the skin every day and use silicone sheets to hydrate the scar tissue and reduce collagen production in the area, helping to flatten and soften the scar. Finally, knowing how to tend to your scars and which products are suitable is essential in improving their appearance. Avoid irritants like hydrogen peroxide, rubbing alcohol and antibiotic ointments on your scars. These treatments can cause the proteins in the wounds to break down, causing inflammation and delayed healing process. Instead, clean your incisions gently with soap and water only twice a day until they're fully healed. At CREO Clinic, we also offer post-surgical scar management that can help in the healing. If this is of interest to you, please get in touch to know more.